Which arm should you get your COVID vaccine in? That's a question that a lot of you guys have been asking me. My name is Dr. Jen Caudle. I'm a practicing family physician. I've gotten both of my COVID vaccines. I'm giving you tips and tricks to address just this, and also tips to address any pain that you might have when you get your COVID vaccine, because it can cause arm pain for some. First of all, my advice would be, and this is something I tried to do myself, is to make sure I wasn't doing any extra exertional activities the day or two before I was getting the vaccine. Certainly it's up to you. It's your choice, but I tried to avoid lifting extra heavy things. I'm certainly not lifting heavy weights, so that wasn't a problem, but that type of thing so that my arm was not already going to be sore going into the appointment. Okay, the other thing is when you do go into the appointment, you want to make sure to get your COVID vaccine, you want to make sure that you're as relaxed as possible. Being relaxed and keeping your arm relaxed likely will help the pain. Now, in terms of which arm you should get the vaccine in, it really is your choice, but this is how I suggest my patients choose. First of all, some patients have arms that they're allowed to use for things and arms that they are not, depending on what their medical history is. If that's you, certainly go by that, go by your doctor's recommendations, okay? If you can use either arm and it's completely your choice, my recommendation and what I did for me is I use my non-dominant arm. So that means if you're right-handed, get the vaccine in your left arm. If you're left-handed, get the vaccine in your right arm. The reason for that is because your dominant hand is going to be the hand that you do in your arm. You're going to do most things with that arm and hand. You're going to open cabinets. You're going to pick up your toothbrush. You're going to write. You're going to do all these things. If you've got pain in that arm, it could certainly be that much worse, right? So try to choose your non-dominant arm if possible. That is something I recommend to my patients. I do myself. Of course, talk with your doctor as well. Now, some things to help you with the pain. The CDC says that if you have pain or discomfort, which again, many people do after getting the COVID vaccine in their arm, also other vaccines too, not just COVID vaccine, you can talk to your doctor about taking an over-the-counter medication such as ibuprofen or acetaminophen. As you guys know from my videos about my vaccine journey, I did take ibuprofen, but you got to talk to your doctor to see what is right for you, if anything at all. Also, the CDC recommends that you can apply a clean, cool, wet washcloth over the arm that may feel a little bit sore. That might give you a little bit of a soothing feeling, which is good. They also recommend using the arm or exercising the arm. Now, that might be a little difficult if you've got a lot of soreness and tenderness, but gentle movement probably is a good thing, and that's something I tried to do with my arm soreness as well. Now, one thing you should keep in mind, and the CDC does mention this, is that if you have redness, tenderness, swelling where you got the shot and it increases over 24 hours or increases as time goes on, you need to be talking to your doctor. That's very important to do. So don't blow that off. Don't overlook that, okay? But for many people, just talking to your doctor to see if you can take something over the counter will work. Guys, I hope this is helpful. It's really important to be thinking ahead, planning ahead. I know getting the vaccine is something that many of you guys are trying to do. You're trying to get on lists to be able to get the vaccine. What's important is that you be prepared and that you get it. So I'm happy to see so many people are getting the vaccine. Let me know in the comments if you plan to get the vaccine or if you already have. Guys, thank you so much. I will be back tomorrow with more updates on COVID and so much more. Make sure you keep it locked here. Oh, and if you've not liked and followed my page, please do so. All right, guys, I'll see you soon.